my name is Jared. I'm the pharmacist here at UT PSD2 Pharmacy. Can I confirm your name and date of birth?
Sure. So my name is Pamela William, birthday 17/90/60.
Okay, and do you have any medication allergies?
So far, I don't have any allergy.
All right, no allergies. And do you know which medication you're picking up today?
So my physician told me about an inhaler, and it starts with the S. I'm not sure.
Okay, I do have a symbicort inhaler ready for you to pick up today.
Okay.
All right, and did the doctor tell you anything about the inhaler, what it's going to be used for, or anything like that?
So he told me that I'm going to use an inhaler for my asthma, and he also mentioned about that I have to prime the inhaler, but he said the pharmacist is going to tell me more about how to use it.
Absolutely, yes. So it is for your asthma, and we'll talk about priming the inhaler later on in this counseling session.
Okay, thank
So it is the Symbicort inhaler. It's the 80 micrograms by 4.5 micrograms. And the generic name, it's budesonide and formoterol. The directions are that you're going to inhale 2 puffs by mouth twice a day, every day. And you'll get 1 inhaler with this prescription right now. There are 5 refills with this prescription. Okay. So you're correct, this is for your asthma. So this inhaler is going to help you prevent having asthma attacks and decrease the frequency of those acute asthma attacks where you'll have to use your rescue inhaler, okay?
Okay.
So this is a metered dose inhaler, so you'll want to store it in a dry place at room temperature with the mouthpiece down. So just store it upright, okay? And then you'll want to discard it after 3 months from opening the container, okay?
Mm-hmm.
With the Symbicort inhaler, there are a few side effects that you may want to look out for. Stomach ache, vomiting, headache, and an increased blood sugar could all occur. And you can also have nasal congestion and even pain in your throat. One important thing that I want you to look out for is oral thrush, and there's a way to do that, to avoid that. This is a steroid inhaler, so after each use, I'm going to need you to wash your mouth with water and then rinse it and spit it out for me, okay? And that'll help prevent any infection that may occur in your mouth.
Okay, gotcha.
Okay.
Mm-hmm.
With the Symbicort, it could take up to 2 weeks for it to be in full effect, and I'm going to need you to monitor your breathing and record any asthma attacks that you may have, okay? I've already checked with your medication profile, and there are no other drug interactions that you need to look out for.
All right, sounds good.
Yep.
Mm-hmm.
Like I said earlier, there are 5 refills on this prescription, so when you need a refill, please give us a call. And if you miss a dose of the Symbicort inhaler, since you'll be taking it twice a day, do not take 2 doses at the same time. So 2 doses in the morning and 2 doses in the evening, but if you miss that dose, don't take them close together. Just skip to the next time you need to take it, okay?
Okay.
All right. Do you have any questions so far?
Yeah, I don't have, but yeah, thank you.
Yeah.
Mm-hmm.
Okay, so now we're going to go through how to use the device, okay?
Okay.
So you're going to want to take the inhaler out of the package and the foil pouch. So if you've never used the inhaler before, if it's new, like this one is, or if you haven't used it in 7 days, we're going to have to prime the inhaler. And we're going to do that by shaking it well for 5 seconds. So once you count to 5, you'll remove the mouthpiece and you will press down on the actuator to release a test spray. And then you'll shake again for 5 seconds and do another test spray. And then your inhaler will be primed and ready to go. So every time you take a dose of your inhaler, you're going to want to shake it for 5 seconds each time.
Okay.
All right. And when you take the mouthpiece off, you're going to want to take a look at it and make sure that there's nothing in there on the inside.
All right, gotcha.
To actually inhale the medication, You're gonna wanna breathe out fully and completely, and then place the inhaler in your mouth and put your lips closely around it, and then make sure the inhaler is upright and is pointing towards the back of your throat. And then you'll press the actuator down on the top and take a nice deep breath and hold it in for about 10 seconds or for however long you feel comfortable. After that, you can take your finger off the top and then breathe out normally. And that will be your first inhaled puff. Again, you need to do 2 puffs twice a day.
Alright.
So then you'll shake it again for 5 seconds and repeat that process. And the most important thing, like we mentioned earlier, is that once you have done both puffs of a dose, make sure you rinse your mouth with water and then spit it out. Okay? And the last thing is that you wanna, to clean the inhaler, you just wanna wipe it with a dry cloth, and do not use water or a hand sanitizing wipe. Just a dry cloth should be okay.
Okay, so there's no sanitizer or there's no water with that one?
Yep, no sanitizer or water needed.
Okay.
All right, that's all I have for you today. Can you tell me a few things that you learned from this counseling session?
Sure, it's really helpful. So the symbicort inhaler will help me to prevent asthma attack, and also I have to inhale two puff twice daily, and not as need, right? And I have 5 refill for my prescription, so make sure to call the pharmacy every time I want to refill. And I may experience some side effects such as stomach ache, like vomiting, nausea, and you also mentioned about infection in the mouth. So you say that I have to wash my mouth with water and make sure to spit out after washing with the water.
Yep.
And then because the medication will take effect like after 2 weeks of using it, so I have to record if I have any asthma attack for future document for my doctor. And yeah, if I miss any dose, just make sure that I don't like use twice, like double the dose that I got prescribed. And if it's too close to the next dose, maybe I just skip it. And also how to use the device. So there's some important point that you will mention that I have to prime if I use it for the first time twice. So, and then shake it for 5 seconds. And also make sure that I have to clean the mouthpiece like with the dry cloth, not with the water or sanitizer. And then you also mentioned about exhale fully, right? Like before using the inhaler. And yeah, I think that's all
All right.
yeah. And oh yeah, and you also mentioned about hold the breath for 10 seconds, right? Because it's gonna be better to get the medication
Correct.
too. Yeah.
Yep, you'll wanna hold it for as long as you can, or up to 10 seconds, all right?
Alright, gotcha.
And if you don't have any other questions for me, here's your prescription.
Alright, thank you.
And then you can give us a call if you have any questions.
Alright,
Have a
thank you
great
so much.
day.
You
You're
too.
welcome.
Bye.
Thanks.